The patient population are patients with back and neck pain that have a very common procedure called a block. Further investigation by the CDC and the FDA indicate that there was one compounding pharmacy in Framingham, Massachusetts that had been the supplier of what appears to be a contaminated methylprednisolone acetate or depo-medrol injection, commonly used as the steroid part of the block. They have made a recall on all of the 17,000 plus vials shipped out all around the United States. Mainly on the whole eastern seaboard. There are a couple of shipments that appear to have been made on the West Coast, California. And then the center of the country seems to be quite bare in terms of whether or not this Framingham, Massachusetts compounding pharmacy sent vials to them, and it appears not. So if you're a physician in South Carolina, it appears only one shipment, when the FDA looked back at the logs, only had been made to one shipment to one clinic in Mount Pleasant. It doesn't appear that any other product had been shipped to other places in South Carolina, and in fact we have not had any, thank goodness, any cases yet here. Here at MUSC, in the MUSC Spine Center, we use medications all from the manufacturers directly, and we don't have intermediary compounding pharmacies that provide agents. So the sterility is intact for the medicines that we're prescribing. It's not a communicable form of meningitis, only communicable through needle injection into the central nervous system, as these individuals had. This is almost an unheard of type of meningitis. It's not the kind of meningitis that you think about when you think about our new Army recruits coming down with a bacterial form, or rarely we hear about high school children that can come down with meningitis, and these are very, very communicable and very dangerous. And then what should I look for if I had an injection? And the things that the patient should look for, in fact, are worsening of their symptoms, whether it's locally after an injection, or for any procedure, if you come down with a fever or stiff neck, headache, photophobia, these type of things, definitely call your physician immediately. And if you can't get a hold of them, it's important to go into the nearest local emergency room, because time is crucial.